Oh, just looking that way.
Yep,
Oh,
I'll
okay.
ask
I didn't
you
know. I thought you
questions.
were in it too. Okay.
Yeah, no, sorry, just look at me. Don't like it, we'll do it again, and the whole thing's gonna get whittled down to like a minute 15.
Oh, okay. All right. So it'll just be like 3 questions, and we'll kind of just space it out in between other stuff like we usually
Yep.
do.
Yep,
Okay.
exactly.
So what's the first one? Just so, are you gonna? Is the
I'll
question
ask-
gonna be on? How's it gonna
You
be?
will not hear the question, so you can either reinstate it or just answer it, and I'll be talking
Okay.
between it.
All right.
So yeah, but I'll ask the question. Just look at me.
Okay. All right. And then do you want me to stand any particular way or
Just don't like do this.
don't wobble?
Yeah. If you talk with your hands, that's fine.
Okay.
Just try to stay in this space.
Sure. All right. So you can ask the question. I got some time to answer then, right? I can just think about it for a second.
Yep.
Okay. Cool.
Okay, so the first one is, does being overweight make it more difficult to fight a virus like COVID?
Gotcha. All right. And then are you gonna have like a follow up like after that about like why that's the case or something?
The next one's why. So you can do them both in one if you want.
Okay. All right. I just want to make sure I streamline the answer. All right. All right. So why is obesity a risk factor? Okay. All right. In regards to obesity and the coronavirus, let me just start over. That sucked.
We love tape. All good.
In regards to obesity and the coronavirus, we are learning a lot, and obesity could be a potential risk factor for people actually developing the virus and getting it from other people. We're still learning a lot about this, but it appears to be a significant risk factor here in the United States. We weren't really seeing that beforehand because from China, their typical patient population, the obese population, is less than 10%. Here in the United States, it's actually around 40%. So we're actually seeing a higher number of patients coming into the hospital who are actually obese and have coronavirus.
That's interesting. So why is that? Like, what about obesity makes you more vulnerable?
So we're still learning a lot about what makes obesity a risk factor for getting COVID. Part of the reason just might be to the actual excess weight that people have that pushes a little bit more stress on the body, makes it a little bit more difficult to breathe. And we're still learning how the virus really works, but it affects the lung tissue and increases inflammation. So if you have more body weight, it creates more resistance and makes it more difficult to breathe. So it kind of increases your risk for developing something like COVID. And particularly here in the United States, we're seeing a lot more of younger people develop coronavirus too, and they tend to be obese. And it's that age range between 20 and 40 that we're kind of seeing this with the coronavirus. A study just came out from Johns Hopkins University stating that they're seeing this trend in younger patients with obesity come in with the coronavirus. And I think it's just part of our population compared to the Eastern countries that originally got the virus.
That's interesting. And obesity is not something that is like just, it's not surprising that it makes you at higher risk for COVID because there are a lot of other health conditions that obesity kind of makes you apt to get. Talk about some of those.
Sure. So it's not surprising that obesity can be a risk factor for developing coronavirus. We kind of see it here as a pre-existing condition for developing other medical problems such as high blood pressure, high cholesterol, diabetes, kidney disease, lung disease, even other cancers. So it's not surprising that people who are obese are a little bit more prone to developing the virus as well.
So overall, you're going to help yourself if you can work to decrease your weight if you are obese, COVID or not. Do you have suggestions for what people can do, especially during a pandemic? I mean, I see a lot of pros in this, right? And people may have some more time. People might have some more control over their atmosphere and their diets and their schedule. Any kind of advice for just general health and trying to lose some of the stones during?
Sure. So we already know that bariatric surgery is an option for patients who are obese, and we're already treating that aggressively here in the United States as the number of our obesity patients are climbing still. But there's a lot we can do. We already know of all the medical problems associated with obesity, so should be even more incentive for people to really take their obesity seriously. Unfortunately, for younger patients, they could be obese, but they're not really manifesting as far as those other comorbidities. They don't have the high blood pressure yet, or the cholesterol problems, or the diabetes. That's kind of a gradual process. But if you stop it early on, you can prevent those things from happening. And I think having COVID as another aspect to trying to treat obesity, I think it's another reason that people should take it more seriously. In this environment, people are trying to maintain a safe distance from each other. It's hard to kind of get into healthy shape, especially if you are obese, especially when gyms are closed. And if that's something that you enjoy doing, and going to the gym is something that's how you work out, that can be tough. As far as other options, people can utilize the internet. I think the internet's a great source. You can go into YouTube, you can search any type of workout, and even if you're overweight and have difficulty working out, you can make little fine changes to the workouts that are out there. There are some that are catering to obese patients that are not as aggressive as some of these other workout programs that people can participate in, at least get some physical activity in that they can do right from their home. They don't need weights, just use their own body weight, and they can get a good exercise in. And then always trying to make good nutrition choices as well. I know that's difficult when there's a big virus going on, and a lot of times we try and go to our comfort foods. Yeah, I know, I felt it going. With the virus going on, it's kind of tough to make good nutrition choices just because we feel comfort with certain foods. But we have to make that a priority if we really want to take control of our health, and when we know obesity is potentially a big risk factor for the coronavirus.
Anything else that you would say? The stuff about not being able to learn about it because of the low obesity rates in China is really interesting. You know, that we couldn't use that to base our...
Right, that's what that study from Johns Hopkins was kind of pointing out. We were seeing all this older elderly patient population coming in, but that's because they don't really have the obese population. And now here, it's a lot more younger patients between that age range and that younger age range, under 50. And they seem to be obese, so there's got to be some type of correlation. We just don't know why.
Yeah. Do you have any questions?
Is that good?
Yeah.
Okay.
Yeah. Great.
All right.